Hi, I'm Susan Taylor with Scripps Health in San Diego, California. San Diego County health officials are warning of a tripledemic this winter season, as 3 viruses, flu, COVID, and RSV, could put a lot of people's lives at risk. Joining us to talk about the need to protect yourself by getting your flu and COVID vaccines right away is Dr. Ming Geary. She is an internal medicine doctor with Scripps Clinic in Rancho Bernardo, California. Doctor, thanks so much for being with us.
Hi, Susan. Thank you for having me.
So talk about this tripledemic.
Yes, the tripledemic. Now, everybody's heard about the pandemic, and tripledemic actually refers to a rise of 3 viruses that we're seeing this winter in the United States. It is the COVID, which everybody's familiar with, the flu, which people are also familiar with, but also RSV, which is a virus that actually causes a lot of illness, especially pre-pandemic in children as well as adults. But what we've seen is pre-pandemic that although most cases were actually flu and RSV, with the pandemic and the mitigation measures that came in place, including social distancing, closure of schools, masking, that a lot of the non-COVID cases of respiratory illnesses and viruses actually went down. But with loosening of these mitigation measures, we're actually seeing a rise of those cases now, especially RSV. And in children, we're seeing a spike in actually hospitalizations of young children, leading to significant morbidity and even deaths.
So according to the Centers for Disease Control and Prevention, up to 20% of the population gets the flu every year. Hundreds of thousands of people end up in the hospital, and 36,000 people die every year from the flu.
You're absolutely right. And I think flu doesn't get as much attention as COVID has in the past couple of years, but the flu is definitely a very serious and significant virus that can cause morbidity and mortality. The important thing, though, is with the flu is that there is a vaccine that you can get to help protect yourself. And getting the flu vaccine every year will help to decrease the risk of hospitalization and also risk of death.
At what age should you start to get the flu shot?
The flu shot is available for people 6 months and up. And of course, if you are older, there's also increased risk of getting seriously ill. And so we definitely have a recommendation for that population. In fact, there's a special vaccine for people 65 and up as well.
That's a high dose vaccine, right?
Correct. That's a high dose vaccine. And what our studies have shown is that a high dose vaccine for those 65 and up shows that it's more effective than the standard dose vaccine.
So when should you get the flu shot to give you the maximum benefit?
The CDC recommends that people get the flu vaccine between September and October, as it takes about 2 weeks for the vaccine to actually take an effect. But the reality is it's never too late. And anytime during the flu season, you should actually still get your vaccine. So if you have not had a chance to get your vaccine, I recommend you go get it now. Again, we're seeing the surge in cases. It is very contagious, and getting this shot will actually prevent you from getting very sick. So if you haven't gotten it yet, now's the time to go get it.
Getting the flu shot does not protect you from getting COVID. So let's talk about getting the COVID vaccine. Who is eligible, starting at what age?
A very good point. Getting the flu shot does not protect you from getting COVID, and COVID vaccines are now available for age 6 months and up. There are boosters available for ages 5 and up. And so, and here's the thing, you can get a flu shot and a COVID shot at the same time.
How often should you get a COVID booster shot?
So the current recommendations are that if you've had your primary series and it's been more than 2 months, you can actually go and get your COVID booster shot.
And if you got COVID, how long should you wait after having COVID to get the COVID vaccine?
Hopefully you have not gotten COVID, but if you have, there's a assumed protection that you may have from your infection. And so you may wait 3 months after you've been diagnosed with COVID, or when you've tested positive for COVID, to get your COVID shot.
And then talk about RSV. Who is most at risk for this?
Yeah, RSV is a very common virus, and it can affect children as well as adults. And most people would actually have common cold symptoms. But in infants that are actually younger than 1, and particularly younger than 6 months, there's a high risk of actually lower respiratory infections, such as bronchiolitis, which is a severe infection, inflammation of the small airways, or pneumonia. And so that population can be at much higher risk of hospitalization and even death. And of course, if you're older or you have chronic respiratory conditions or immunocompromised conditions, you can also be at risk of complications as well.
And there's no vaccine for RSV?
Unfortunately, there is not. But as I said before, there's vaccine for the flu and for COVID. So get those and you'll be much more protected against illness this winter.
So what about multi-generational families, kids, parents, grandparents who all live in the same house? These viruses are really transmissible.
RSV in particular is transmissible through direct contact and through secretions. And so if you've actually touched something that actually has virus on it or is contaminated, and then you touch your face, you touch your mouth, you can actually get it that way. So we recommend that if you're in a household where RSV is circulating, make sure that you wash your hands, don't touch your face, wear a mask if you're sick. These are very easy ways to actually protect yourself from spreading RSV. But of course, if you have anybody in the household with flu or COVID, we have precautions for those as well.
And what are those precautions?
Those precautions include if you actually get, and I would say they're very similar for flu and COVID. If you have somebody in the household who actually has flu or COVID, they should socially isolate. They should wear a mask if you're in a public place. You should avoid sharing food and utensils. The idea is that for at least 5 to 7 days after you've been diagnosed, you should really stay away from the other family members in the household, particularly if they're at high risk of getting sick if they catch COVID or flu.
So where can you get your flu and COVID vaccines?
You can go to myscripps.org and make an appointment. Now, wait times may be a little long, so be patient because everybody's trying to get the vaccines at this time. Of course, you can always go to your local pharmacy and get your vaccines there. The important things, do not wait. You want to be protected as early as possible during this tripledemic.
If you don't get the flu and the COVID shots, what kind of risk are you taking?
These viruses can actually cause severe illness, including hospitalization and even death. And if you have chronic medical conditions such as diabetes or heart disease or lung disease, your risk is that much higher. And this is something that is potentially preventable. So we recommend, please go get your vaccines. There's very little reason not to do it. Do it for yourself, for your family, for your neighbors, and for the community.
Any final thoughts, doctor?
We truly believe in preventive care, and this is something that we can really make a dent in as a society. An ounce of prevention worth the pound of cure, as they say.
Any advice that you would give?
Yes, if you do get sick, do not panic, call your doctor, but to prevent getting sick, as we said, wash your hands, avoid touching your face. If you're sick, stay home, avoid spreading the viruses, this tripledemic, as we say, to others.
Doctor, thanks so much for being with us. We appreciate you taking the time.
Thank you, Susan. Thank you for having me.
If you want more information on getting your flu and COVID vaccines so that you avoid this tripledemic, please click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.